Obesity is a significant public health issue in the United States, affecting millions of people and posing substantial challenges for healthcare systems. According to the Centers for Disease Control and Prevention, CDC, approximately 42.4% of adults and 19.7% of children and adolescents in the U.S. were classified as obese in recent years. When combined with the prevalence of overweight individuals, these figures reveal that over 70% of American adults and a substantial portion of children fall into these categories. This widespread issue has far-reaching implications for individuals, families, and society as a whole. Obesity is defined by an excessive accumulation of body fat, often measured using the body mass index, BMI. For adults, a BMI of 30 or higher indicates obesity, while a BMI of 25 to 29.9 is classified as overweight. Several factors contribute to the high prevalence of obesity, including poor dietary habits, sedentary lifestyles, genetic predisposition, and environmental influences. The modern food environment, characterized by the widespread availability of calorie-dense, nutrient-poor foods, coupled with reduced physical activity, has created a perfect storm for weight gain. The health consequences of obesity are profound and multifaceted. Excess body weight is associated with an increased risk of chronic diseases, including type 2 diabetes, cardiovascular diseases, hypertension, and certain types of cancer, such as breast and colorectal cancer. Obesity also contributes to respiratory issues like sleep apnea and musculoskeletal disorders, such as osteoarthritis. Beyond physical health, obesity can negatively affect mental health, leading to depression, anxiety, and social stigma, which further complicate efforts to achieve and maintain a healthy weight. The economic burden of obesity is equally concerning. It accounts for billions of dollars in annual healthcare costs due to the treatment of obesity-related conditions and lost productivity. Addressing obesity requires a comprehensive approach that includes public health interventions, policy changes, and individual efforts. Education about healthy eating, increasing access to nutritious foods, promoting regular physical activity, and addressing systemic barriers such as socioeconomic disparities are critical steps in combating this epidemic. In conclusion, obesity is a pervasive issue in the U.S., affecting a majority of the population and contributing to a host of health problems. Tackling this challenge requires collective action and a commitment to creating environments that support healthier lifestyles. By addressing the root causes and fostering awareness, it is possible to reduce the prevalence of obesity and improve the overall health and well-being of the nation. Glucagon-like peptide 1, GLP-1, is a hormone naturally produced in the gut that plays a crucial role in regulating appetite, glucose metabolism, and energy balance. Its discovery has revolutionized the approach to treating obesity and related metabolic disorders. GLP-1 is part of the incretin family of hormones, which are released in response to food intake. It primarily acts by binding to GLP-1 receptors in the pancreas, brain, and other tissues, initiating a series of biological responses that contribute to its effectiveness in weight loss and diabetes management. One of the key mechanisms of GLP-1 is its ability to enhance insulin secretion in response to elevated blood glucose levels, making it an essential player in glucose homeostasis. Simultaneously, it inhibits glucagon release, which prevents excessive glucose production by the liver. This dual action helps to stabilize blood sugar levels, particularly in individuals with type 2 diabetes. In addition to its effects on glucose regulation, GLP-1 slows gastric emptying, leading to prolonged feelings of fullness after eating. This delay in digestion reduces appetite and promotes reduced caloric intake, making it highly effective for weight management. GLP-1's impact on the central nervous system also contributes to its efficacy. By acting on receptors in the hypothalamus, GLP-1 suppresses hunger signals and enhances satiety. This neurohormonal effect reduces the frequency and intensity of cravings, making it easier for individuals to adhere to healthier eating patterns. These combined effects make GLP-1-based medications, such as semaglutide, marketed under brand names like Ozempic and Wegovy, powerful tools for weight loss. Clinical trials have demonstrated the effectiveness of GLP-1 receptor agonists in achieving significant and sustained weight loss. Patients treated with these medications typically experience weight reductions of 10 to 15% of their body weight over several months, outperforming traditional methods like diet and exercise alone. Moreover, GLP-1 therapies are generally well tolerated, with mild side effects such as nausea or gastrointestinal discomfort that usually diminish over time. GLP-1 therapies address the biological underpinnings of obesity, distinguishing them from many weight loss strategies that rely solely on behavioral modifications. By targeting the physiological drivers of appetite and energy balance, GLP-1 offers a scientifically grounded solution to a complex and multifaceted condition. As obesity rates continue to rise, GLP-1 receptor agonists provide a promising avenue for improving health outcomes and reducing the burden of obesity-related diseases. While GLP-1 receptor agonists have proven to be effective for weight loss and glucose regulation, they are not without potential side effects. Like any medication, their use may lead to adverse effects, which vary in severity and frequency among individuals. Understanding these side effects is crucial for patients and healthcare providers to make informed decisions about incorporating GLP-1 therapies into treatment plans. One of the most common side effects of GLP-1 medications, such as semaglutide, Ozempic, Wegovy, and liraglutide, Saxenda, Victoza, is gastrointestinal discomfort. Many patients report experiencing nausea, vomiting, diarrhea, or constipation, particularly during the initial stages of treatment. These symptoms often occur as the body adjusts to the medication and are usually dose-dependent. To minimize these effects, healthcare providers typically start patients on a low dose and gradually increase it over time. Another potential side effect is a slowed rate of gastric emptying, which, while beneficial for reducing appetite, can occasionally lead to discomfort, bloating, or feelings of fullness. In rare cases, this effect may exacerbate conditions such as gastroparesis, a disorder characterized by delayed stomach emptying. Hypoglycemia, or low blood sugar, is another concern, though it is more commonly observed when GLP-1 medications are combined with other glucose-lowering drugs like insulin or sulfonylureas. Patients are advised to monitor blood glucose levels closely and adjust other diabetes medications under the guidance of a healthcare provider. In some instances, GLP-1 receptor agonists may lead to more serious side effects, though these are relatively rare. Reports of pancreatitis, inflammation of the pancreas, have been associated with these medications, necessitating caution in patients with a history of this condition. Additionally, animal studies have suggested a potential risk of thyroid C-cell tumors, though the relevance of these findings to humans remains unclear. As a result, GLP-1 medications are contraindicated in individuals with a personal or family history of medullary thyroid carcinoma or multiple endocrine neoplasia type 2. Other less common but notable side effects include injection site reactions, mild increases in heart rate, and potential gallbladder issues, such as gallstones. These effects underscore the importance of regular monitoring and communication between patients and healthcare providers during treatment. In conclusion, while GLP-1 receptor agonists offer significant benefits for weight loss and diabetes management, they are associated with a range of potential side effects, from mild gastrointestinal issues to rare but serious complications. A careful evaluation of risks and benefits, tailored dosing strategies, and ongoing medical supervision are essential to optimize outcomes and ensure patient safety. Good candidates for GLP-1 injections. Patients who are good candidates for GLP-1 receptor agonists typically meet certain clinical criteria. These individuals include those with type 2 diabetes who have not achieved adequate glycemic control through oral medications or lifestyle modifications. GLP-1 injections are particularly beneficial for patients with obesity, as these medications often result in significant weight loss by reducing appetite and increasing satiety. Additionally, individuals at high risk for cardiovascular disease may benefit from GLP-1 agonists due to their demonstrated cardioprotective effects. Patients with a strong motivation to adopt healthier lifestyles, including dietary and physical activity changes, are also ideal candidates. Combining GLP-1 therapy with lifestyle interventions can enhance the medication's effectiveness. Furthermore, those who tolerate injectable medications well and are willing to adhere to regular dosing schedules are more likely to succeed with this treatment. Bad candidates for GLP-1 injections. Conversely, certain patients may not be suitable candidates for GLP-1 receptor agonists. Individuals with a history of medullary thyroid carcinoma, MTC, or multiple endocrine neoplasia syndrome type 2, MEN2, should avoid these medications, as studies suggest a potential association with thyroid tumors. Additionally, patients with a history of pancreatitis or severe gastrointestinal disorders, such as gastroparesis, may experience exacerbation of these conditions with GLP-1 therapy. Pregnant or breastfeeding women are generally advised against using GLP-1 receptor agonists, as their safety in these populations has not been established. Individuals with a history of severe allergic reactions to GLP-1 medications or their components are also contraindicated. Conclusion: GLP-1 receptor agonists offer significant benefits for managing type 2 diabetes and obesity, but careful patient selection is crucial. Clinicians must assess each patient's medical history, comorbidities, and overall health goals to determine whether this therapy is appropriate. Tailoring treatment to the individual ensures better outcomes and minimizes potential risks associated with GLP-1 injections. Thank you so much for watching our video on GLP-1 receptor agonists. We truly appreciate your time and interest in learning more about this exciting class of medications and how they can benefit individuals managing type 2 diabetes and obesity. Your support means the world to us, and we're thrilled to have you as part of our growing community. If you found this video helpful, don't forget to give it a thumbs up and share it with anyone who might benefit from this information. We'd also love to hear your thoughts, so please leave a comment below to share your feedback, ask questions, or suggest topics you'd like us to cover in future videos. Your input helps us create content that truly resonates with you. Make sure to subscribe to our channel and hit the notification bell so you'll never miss out on our latest uploads. We're dedicated to bringing you informative, engaging, and up-to-date content on health, wellness, and medical advancements. Stay tuned for our next video.